Thank you so much for being here today.
Thank you very much for inviting me, Diana. It's exciting.
It's very exciting for everything that you've done. You're a powerhouse in the endometriosis community on an international level. You're the founder of the World Endometriosis Organization. And I just have to ask, because you have been given awards for all your pioneering work in this field, but what first brought you to endometriosis? What made you so passionate?
I'm so glad you've said that, Diana, because people just don't ask me. I think I have no idea why, but the real reason is that I was diagnosed with endometriosis in 1985, and I'm sure that many of the followers of this program won't have even been born then. So yes, a diagnosis then, and I was in teaching. I did a lot of stage work, a lot of media work, and I love dance and drama and all of those things. But largely my career background is in secondary school teaching.
So then that's what brought you to wanting to educate and bring awareness to the disease.
Yes. So about that time, I met two other professional women, one a financier and the other in senior management nursing. uh, After one meeting, we decided to establish the New Zealand Endometriosis Foundation Incorporated. The organization was registered as a charity in January 1993. And the three of us complemented each other extremely well. But the one thing that we did very early on in those days was we firstly couldn't believe that no one knew what we were talking about. I wonder what's changed. We couldn't believe that no one, that here we were, articulate women young women then, able to express ourselves and what we were going through, and yet we felt so disbelieved. We were suffering dreadfully. So we decided to just do this. And once we'd set up the organization, in fact, our own personal stories paled into insignificance. In those days, it really wasn't cool to tell your story. And because I really had a long-term vision, uh, how many times can you tell a story? It didn't seem to be even important, that it was everybody else's story that seemed to magnify for me about this is just unacceptable. And I felt sort of a calling in some ways to be part of an early movement without any internet in those days, to do something about it. I think what we did set us in good stead for the work that was to come. And that was between 1985 and 2000, really. We held seminars, national seminars in New Zealand. People flew in from all over the place. We had speakers and we managed those ourselves as well. And it was very, very clear to me very early on, before it was recognized in the literature and before the world were really talking about it, from what we could see, because of course there wasn't the internet or the publications that we have available to us now. But it was clear that this disease started young. To me, it was clear that despite what the evidence said, that it was I think Time magazine had a headline, the white career woman's disease, um, that in fact it didn't discriminate. And that in fact it started often from a girl's first menstrual period, because the stories we were hearing then, despite the women attending these seminars, and we had hundreds attending the seminars, they flew in from all over New Zealand, um, and that their symptoms started young. And that's when I decided to put the skills that I had into action and think about developing a menstrual health and endometriosis program in schools.
I mean, so ahead of the times, because here in the United States, we're still trying to implement that. It's happening in New York. We were able to help lobby legislation to be passed, but the fact that you have done that is just incredible, and you're throwing the stone for the rest of the nations to follow.
Well, thank you. And, I think now we read in all the literature, and I know that Dr. Sedgkin, for instance, is a great believer in recognize the symptoms early and intervene in a timely manner. And in fact, that really is the basis of the ME program in schools. And of course, now it's been delivered to hundreds of thousands of students, and we have some very good data, and it is published in the medical literature. I think the thing from that that's so exciting is that just before lockdown last year, we started looking at, okay, so we've got one educator, one car, one session at a time. It's got to be a better way than this, right? So we spent a lot of time in 2019 and 20 developing Me Online, which is now so exciting because we've got the most beautiful online program that is medically responsible, age appropriate, interactive, fun, and it's also got gamification in it, and we're really excited to release it. It's ready to go. But I was just approached by Otago University down in Dunedin in New Zealand, who said to me, we really, really want to support this with an evaluation study on our students. So we're pretty excited about getting underway with that very soon, and launching it, really.
That's
It's,
incredible.
yeah.
So you obviously have encountered many individuals with endometriosis and family members, loved ones who are supporting someone with endometriosis. What have you learned over the years about this disease? What takeaway have you gotten from it?
It's mean.
Hmm.
It's a really mean disease. And I say that from many perspectives. It's mean because it's often silent, because the suffering is often silent, because of the plethora of misinformation, um, because of a lack of peer review and publications that we can trust and rely on, because we simply don't know in some of the work that we're doing, um, that, and of course that is exacerbated through social media often, sadly. I know there's a great deal of love and nurturing and support through those platforms as well. Um, but I think because the things that we experienced back in the 80s, I look now and I think, what's changed? And
Mhm.
are we actually making a difference? I think there are wonderful advocates out there now, but unless we cannot keep being the ambulance at the bottom of the cliff, we must be with our health decision makers and be making legislative change that introduces a, a clinical pathway for the treatment and management of endometriosis in our countries. And that's what I did in 2015, because I was so angry that here in New Zealand, we've got such a wonderful resource in many of our doctors with expertise and allied health professionals. But we have a public and a private health system here.
Mhm.
Mostly people don't have private health insurance. And so for some people to access care, be it through geographical isolation, or because there's a lack of expertise or a lack of knowledge, or because the waiting lists are just so long, there's just a manner of reasons. It's mean from that perspective. It's mean that it starts so young, and girls are often disbelieved. And that's where uh, education in schools is so paramount, because we can teach them to
Mhm.
recognize symptoms that stray from the norm, and we can encourage them to to improve their health-seeking behaviors. and to know what treatment and or management they should be accessing. I think the biggest thing
Mm.
it's mean is because we don't often believe.
Yes.
And you asked me what things have changed, Diana. For me, I think the biggest change has been what I see so terribly, sadly, in the mental health
Mm.
that this disease causes. Uh, Women are verbalizing that now. When I work with mothers and fathers whose teenagers have written suicidal letters,
Mm.
it's distressing, and we cannot, as an international endometriosis community, allow this situation to continue. And that's when or actually, 20 years ago, my gosh, I developed my own private practice. And so you'll see in my signature that I have EP coaching and consulting. So this is endometriosis and pelvic pain, well health coaching for well-being. And I introduced this, I do this, and I have been for 20 years, in centres of expertise in New Zealand. So I have one clinic in Christchurch and 5 in Auckland of patients, and they're referred to me from gynecologists we work with in a multidisciplinary centre of expertise. So I see a lot, funnily enough, when I see my young patients coming through, and in our Christchurch clinic, 62% of my patients are from the end of 2019, because last year was a bit of disaster for us
Mm.
all, um, are under 20, diagnosed, being managed with expertise and care in an age-appropriate environment. So that's something I think that we could be looking at, as saying, what are the things that we can do now that are cost-effective, that will make a difference in a
Mhm.
really clear and concise way. They don't have to be expensive.
Right. And they also don't have to suffer for 10 some odd
No,
years before getting a
no.
diagnosis if they ever get it. It's just like you said, that it's a mean disease. It's also an isolating disease. And even a doctor that has a good bedside manner might doubt the pain that someone's going through. I've been doubted, and I've had, I've been diagnosed with endometriosis and infertility and had multiple excision surgeries, and still people will say, "Are you sure you think that's it?" And
Yeah,
it does make you think, well, maybe I lost it, maybe this time I
maybe.
lost it. But
Yeah.
it's a disease that makes you question yourself a lot.
Absolutely, Diana. That self-doubt, that it absolutely hits your own confidence so hard. You're clearly a beautiful, confident, articulate woman, and yet, what about um, our new immigrant women? What about our Indigenous women? What about women who are less advantaged,
Yes.
and women who don't have the kinds of health insurance that others have? This disease is just so mean on so many levels, and we all need to be working collaboratively
Yes.
and collectively. And that was one of the things that really I started World Endometriosis Organizations. Because let's see, Diana. Now, the pain people have a governing body, right? In New Zealand, it's the Pain Society of New Zealand and the Faculty of Pain Medicine. We have RANZCOG, which is the Royal College of uh, Obstetricians and Gynecologists. We have the Royal College of GPs. They've all got a governing body. These beautiful organizations around the world doing some fantastic stuff. And it's disparate, it's disconnected, and it's a bit piecemeal. And so I thought, when we were at a World Congress in 2017, we had a meeting, and I said, this needs to happen. And others said, yes, we do. Do you want me to do it? Yes. so,
We made it happen.
and that's kind of like, this is a really good idea. I think that's what when I think about my my career, it's kind of been based on, this is a good idea, we're going to do this.
And put
And
it into
that's
action.
really how World Endometriosis organizations come. And as I pass the baton, we've got a steering committee, and as I pass the baton to the next generation, I would love to see the WEO be a really strong governing body for those organizations, a representative voice
Mhm.
to the medical, on the same level actually as the medical colleges right around the world, so that they can be heard, be seen, and have power to actually influence change.
That's music to my ears, because I think that's what we all want for ourselves, for the next generations, so that the suffering can stop and that the voices can be heard and unified, and we can educate together and do research together and eventually find not only better treatment options for all, but also a potential cure.
I love what you're saying, Diana. That's exactly right. So, and it's no different anywhere in the world. We can look and saying, well, it must be better there, the grass is always greener. But in actual fact, this is a disease that we need to consolidate, stop some nonsense, collaborate, be together, united, doctors, patients. After all, we should be absolutely promoting patient-centered care and asking our patients, what's important to you? What really matters to you? And that's what I often do in my clinics. It frequently is not about another surgical procedure. I'm just recalling one clinic I had last week, a woman who was, well, she was referred to me because she was just about to go in for the following week, her 7th procedure. Now, when do we learn that the 6th, the 5th, the 4th, actually, that didn't work? And so I said, what's important to you? What do you really want? And she wanted to lose weight. And she wanted to learn to be able to be intimate with her partner without it hurting, and to be able to communicate that with him. Now, that wasn't another surgery, but it was a whole manner of other things. Just in saying those 2 things, we were able to with her approval and with her at the center of her care, make appointments with the dietitian and the pelvic physiotherapist and a sex counselor. And she had a lovely session with me for her well health and well-being, and a clinical psychologist. And after 3 months, she's just buzzing. Now, those are the stories that, those are the things, while we don't know a lot, we can be assured be listening to our patients much better than we currently are.
Empower the patient.
Yes.
Thank you so much for joining us today. I can't thank you enough, because when I really think about it, I'm a newbie with this disease, as someone who was only diagnosed in 2016. And to have someone like you who has just paved the way for all of us so that we can have a better existence than you went through with your journey. And I can't tell you how grateful I am to you for that.
Thank you, Diana. I hope that I will continue to influence change. And in fact, as I move out of my role as CEO, believe me, I'm not over and out yet. I've got a,
Oh, you got a lot of work to
oh
do,
my
my
gosh,
friend.
I've still got a lot to do with the New Zealand government. I think they're hiding at the moment, but from
Oh,
me.
I know that you are still setting the world on fire.
There's a
So
lot to be done. So I'm really excited about that. I'm privileged to meet you, and it's been an absolute pleasure and an honor to be invited to do this interview with you. So thank you very, very much.
and please come back because there's a lot of other topics that I would love to cover with you.
Oh, for sure. We didn't talk about the Patient Information Day, which is pretty exciting, and I'm very proud to be working on that. And, you know, that's one of the things that I was excited when I saw that you'd partnered with or Endo Foundation had partnered with ISG. What a wonderful opportunity for women worldwide to hear experts, to associate with other women around the world with their stories, and to get a plan of what's important to them and work to that goal. So I'm very, very proud to be associated with it. Thank you.
Thank you.